maybe, or 60 million people living in the very remote areas with no access or difficult access to primary care. So we have been looking to the numbers of the estimated cancer numbers in Brazil, and this is the amount of challenge that we do have ahead. So almost 12,000 new cases each year of leukemia, and specifically CLL patients are in 1/4 of this number. We do have a large database of patients with leukemia and CLL for sure, and each year we expand our own data in approximately 300 cases of CLL. For us, it's really important to understand, and that's what I'm going to show you. I'm going to merge two different experiences, projects that we have been running, and for those who are interested, you can be taking a look at the poster sections, because they are both over there. It's really important for us to understand how is the level of knowledge regarding CLL and the protocols and the very specific needs of the patients when we look to our oncologists and hematologists, because we do have a very restrict number of specialists in the country, and they are not really everywhere. They are concentrated in local, specific urban areas. So we wanted to understand if they know about the disease, if they understand how to treat patients, and how are they doing it. And supporting CLL patients for us is really essential, because we do understand that this is a very specific condition, rare condition, in a country where people do not have lots of information and the health literacy levels are really low. And this could be a change if we do understand and support them and all their needs, and actually giving access to quality information. This might be change in the situations that we do have now: late diagnosis, misdiagnosis, and poor access to the adequate treatment. And this is what we want to change. So as a result of our patient support group for CLL patients, we have been offering free services, but more than that, we have been consolidating a very successful model of holistic support to CLL patients. So we work with our own team. We have 20 healthcare professionals and 30 volunteers, psychologists. So we are able to offering social support, psychological support, legal guidance. We do have our team in 13 different capitals in the country, so we do daily visits to the treatment centers to support the patients and the family members. And we do offer remote support through telemedicine, addressing the questions that the patients might have, talking to family members, caregivers, offering a second medical opinion, or at least trying to support them and monitor all the journey that they do have facing the disease. And this is the way that we do understand that we can offer them reliable and quality information, and also try to build bridges, right, and try to accelerate the access to timely diagnosis and the right treatment, and also empowering the patients, because otherwise we're not going to be able to change the scenario. So for us, it's really important in the whole process of supporting them is to actually make them understand that they do have a voice, they have where to how can I say, where to find help in order to talk to the right stakeholders, and to actually consolidate an easier path to try to make the relationship with their own doctors and own team of professionals much stronger. So from July of 23 and July to 24, we've heard 467 patients there in our database that are having actually access to our psychological support team program, and 7.7% were CLL patients. And within this percentage, 4.8% were in active treatment and 2.9% under monitoring. So when we look to this number of the 7.7% CLL patients, we had this distribution of participating in our activities. 2.8% were having access to brief psychotherapy. For us, brief psychotherapy is 14 sessions of individual psychotherapy. 1% were having access to therapeutic groups, and 3.9% were using psychological on-call services that we started to provide because we actually had identified a need for a different kind of support for urgent matters, because most of the patients in all his journey were assessing us in very different times of the day and at night, calling us and writing messages asking for help to try to cope with some of the great and intense emotional impacts of the disease and some other difficulties. So we realized that having therapeutic groups or delivering therapeutic sessions were not enough. We had to have a 24-hour service of psychological online help for them. So we also started an initiative to understand how was the level of knowledge among oncologists and hematologists, to try to see if they were really having the right access to the protocols, clinical protocols, and understanding how to deliver the best care. So in parallel, we had this survey where we tried to engage these specialists. We have heard 50 of them, so 50 doctors have answered this survey, and we had concluded that we do have differences. We don't have the perfect scenario, not yet, but we still have 8% of the doctors in this collective that did not understand quite well how to treat CLL patients, have never treated one of them, and had no access to the clinical protocols. And well, yes, they do had information. The majority of them had information and had large experience treating CLL patients, but we do realize that we do need to continue to offer education for healthcare professionals and mainly doctors in our country. And the other point that I want to highlight is that we do need to offer specific assistance and support for patients with CLL, because they are still struggling a lot and intensively with their diagnosis and treatment. So bringing this to advocacy, how we are making a change. These are some of the initiatives that we have been doing in advocacy field. So we are presenting the results of our research in the regulatory HTA agencies to try to make them understand the reality, what's going on with patients and their main challenges. We are trying to promote this holistic patient support program and focusing on mental and emotional support, and also medical education as well. Strengthening a partnership with medical societies, and we have this online platform to offer training for healthcare professionals, and at this point we have been training over 45,000 doctors, nurses, social professionals, and this is a very strong initiative that has the support of the Ministry of Health and the federal financing. and we are trying to expand this a little bit further. We are also promoting social participation, so we do represent the voice of the community in several processes in the government and public hearings, and taking the agenda and the challenges of the patients to discuss with the decision-making stakeholders and trying to improve the public policies. We also do this through a coalition because we are not able to make change alone. So we have 300 organizations together working the same agenda, trying to improve the national healthcare policy in oncology. Well, I would like to thank you for the opportunity. I'm sorry I've passed a few minutes in my time. And if you want to know a little bit more of our initiatives and how we are doing advocacy, you could reach us and take a look at our website. And there's a lot of information and some other projects going on. Thank you.